My name is Ashley Stratton, and I'm going to tell you a little bit about hemophilia. If you click on the blue link, control click it, it will take you to a short little video, and that tells you a little bit about hemophilia. But it is a genetic bleeding disorder in which bleeding can be spontaneous and hard to control. It falls into the other health impairment section of the 13 disability categories. Hemophilia affects a student's strength, vitality, and school participation. Symptoms of hemophilia include easy bruising from minor bumps and uncontrolled bruising that just gets bigger and bigger. It can prolonged nosebleeds, which often require visits to the emergency room, bleeding with vaccinations, even everyday normal vaccinations. Students usually need to stay at the doctor's office a little bit longer. There can be excessive bleeding after losing a tooth. The gums are really easy to bleed with just basic toothbrushing. Spontaneous bleeding is usually in the muscles and soft tissue. There can be bleeding into the joints like your elbows, knees, and ankles, which will cause swelling, pain, tightness, and immobility. Causes of hemophilia. Hemophilia is an inherited disease. You cannot catch it. There are two types, A and B, which is factor 8 and factor 9, but they are both inherited, and they are both a gene mutation on an X chromosome, and it causes there to be none to little blood clotting factors produced. And those factors are factor 8 and factor 9. How hemophilia impacts the student in school, and they may have to have an infusion port, which is going to have to be protected and may require a nurse visit during the school day. They may have to wear protective equipment such as a helmet, a vest, shin guards, things like that. There may be some modifications to the classroom, some of which may be to have brighter lighting, no rugs, easy to navigate walkways so you're not bumping into things. Playground equipment should be inspected and repaired immediately, and there are going to be some things that the child with hemophilia cannot play on, like monkey bars, jungle gyms, and there needs to be an alternative provided for that. As well as with PE and sports, there needs to be some kind of alternative. Normal games that people play during PE, kickball, dodgeball, things like that, the student with hemophilia cannot play. So try to have something. They can do light exercise, anything non-contact. Instead of cheer, football, basketball, a sport like swimming or track, tennis, those things are okay for the student with hemophilia. Another problem, or another way that the student could be impacted, is bullying and isolation. And the student can't go outside and play on the playground like everybody else and participate in the same games during PE and the same sports. They may isolate themselves and stay inside and not really talk to anybody. And they could be bullied, if they have to wear protective equipment, if they have to leave and go to the nurse's office multiple times, if they are missing a lot of school and get to make that work up when someone else doesn't. All of that could lead to bullying. The treatment for hemophilia is infusion of factor 8 and 9, 8 or 9, and that needs to be done 3 times a week. And because the factor 8 and 9, they have a very, very short half-life, and it's metabolized by the body extremely quickly. So 3 times a week, and can be done as a preventative, or it can be done on demand. If a child gets hurt, the bleeding doesn't stop, they can be given an emergency dose of the factor in order to cause their blood to clot. Ice and pressure are good for swelling and light bleeding. It will help control all of that. And normally, if everyday student gets injured, has swelling in an ankle, they may take ibuprofen or Tylenol, and the child with hemophilia cannot do that. If the child hits their head, if they have a nosebleed that won't stop, a cut that won't stop bleeding, feel weak, feel dizzy, they need to seek immediate medical attention. Some resources for additional information. There are a few books: The Student with Hemophilia, Teaching Strategies, Hemophilia and School, Developing an Individualized Health Plan, which is more for your school nurse, but it's something that everybody that's involved with the student needs to know about. Hemophilia Federation of America Back to School Toolkit for parents, students, teachers, and caregivers. This is a really good one because it lets the parents be comfortable knowing that everybody else knows what to do. It's also good for the teachers to know how to interact with the student with hemophilia, and to teach the other students about it so that they know what to expect and how to interact. I used multiple references. They are mayoclinic.org, hemophilia.org, bleeding.org, hemophiliafed.org, nationalchildrens.org, cdc.org, kidshealth.org, and stanfordchildrens.org.